and Brad, the two most famous physical therapists on the internet.
Gotta love that science. Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we're the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Science reports successful treatment for arthritis, joint pain, and rheumatoid arthritis.
Exactly, Bob.
So you've got some studies here, Brad.
Yeah, Bob, I decided to do some homework because naturally, as physical therapists, we want to know if what we're doing is really going to do some good. So that's what I did.
All right, very good. If you're new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day. Also, you're going to want to join us on our social media channels because we're always giving something away. Right now, we're giving away the iReliev TENS unit. We're also giving away the iReliev roll-on, which is for pain control. That's the TENS unit right there. We're giving away a couple of those. Great for pain control, great for muscle contraction too. If you need that for something.
Right, that's got EMS option.
Yeah, so just go to bobandbrad.com, go to our giveaway section, or go to Bob and Brad on Facebook. It's always pinned to the top of the page.
Pinned to the top. I like that.
All right, Brad, take it away. You are in charge.
So, arthritis, as we age, I'm starting to feel something in my hand when I wake up in the morning. It's pretty stiff. I can't make a fist, and I'm kind of thinking, this is
the way
DJD. We just say DJD in a therapy world because it's easier to write.
Degenerative joint disease.
Right, as opposed to arthritis. But I know a number of other people that have rheumatoid arthritis and just typical osteoarthritis, joint pain from wear and tear. So what can we do? And we always talk about get the joint moving, because if the joint moves, it's going to be healthier than being a static or a...
That's right. Non-movement is a problem.
Right. So the first thing I found was a simple pamphlet from the Arthritis Foundation, and they talked about if you're able to exercise, if you're in the middle of a flare-up and you have a lot of pain, a lot of joint swelling, may not be the time to exercise, but arthritis tends to flare up and cool down, and get it when it settles down through medication or whatever you're using, then start your exercise. And it's not going to be aggressive. We're not going to go out sprint. We're not going to lift heavy weights.
Right.
It can be walking, water aerobics, resistance exercise, and get some exercise so it increases your flexibility, increases your strength, improves your sleep, all of these things that follow along with general exercise.
And decreases pain versus release of endorphins.
Exactly. Right. Natural.
So lots of good things when you get things moving.
Right.
Arthritis does not arthritic joints don't like to be still. But Brad made a good point. There's times where it's so flared up you just can't move it.
Right.
I mean, and then you just got to try to maybe take some medication for anti-inflammatory and let it calm down.
Right. So more specifically, the science. How do we get to the sciences? I looked up a study from the British Society for Rheumatology. This is 2012. They did this study. It was specifically for resistance training to strengthen the muscles and really work that aspect. And how does it respond?
But you're talking about low intensity resistance training. You're not talking about big heavy weights and such. You're just trying to give a little bit of resistance.
Exactly. So it may just be some dumbbells. I really think, and therapy across the board for years have used resistance training.
Right.
And that's
as far as like exercise bands or exercise tubing.
The results of this study did clearly show that it's safe to resistance train if you have arthritis. It improves. They had a 50-foot walk test.
Oh,
they would look at the quality of the gait and time it, and that improved specifically for these people. As well as they did muscle strength tests with, actual scientific measuring devices to measure, did the muscle get stronger or not by appearance, and that was true. People could improve their strength. So I just want to give an example of what you could do.
Examples here, and this is comes home to me because I had hurt my elbows basically by doing really kind of heavy lifting.
Right.
And I had to go back to the drawing board here and actually use these resistance bands using our wall anchor.
Right.
And the wall anchor, what we do is usually set it up at 3 different levels. The first level is just high enough so you can reach it, basically.
So that one's for Bob. Why don't you move, Bob?
Yeah, that's all right. That one's for Brad.
This one's for me. Now, this one's got 3 bands on it. You're probably not going to go to there. You know, we just pop those off of there.
And that's what's nice. You can start off with one band. But anyway, I went to these, and eventually I was able to work my way out of it. And, you know, even though I'd have a little bit of pain when I start, by the end of the time I was doing it, Brad, I was no longer having pain. So he's showing a good postural exercise here right now. So he's moving the arms, but he's also strengthening the postural muscles. So again, it's great for giving you the variety from going to low resistance training up to, you can throw more bands on, make it more intensity, more higher intensity, right?
Exactly. And with these, you know, at different levels, you can work different muscles. You know, here I'm going to come at this level, and I might just work a rotator cuff, which is good for that shoulder joint. You know, then I can work that elbow joint, work them both at the same time. And then for that hip joints, now this is something that I like. Where did I put that band? Is
yeah, a lot of the kits that you buy along with the wall anchor actually have the cuff that comes along with it. You can work your legs. And what's nice about it is, like this one is a great almost isometric exercise for the knee. I mean, you're strengthening the knee, but you're not moving the knee joint.
Right. Yep. I mean, and you know, you could work it this way.
Sure.
You know, and you know, you can do these sitting down as well. It's, well, not quite like this, but there are options. I'm going to work this hip in all four directions. Just a quick demonstration. So, and again, we can throw that knee in there as well. I'm using a stick to hold on to. We've got the Boya stick, but you can use whatever you have that doesn't slip on the floor. You can hold on to a chair
or a countertop or whatever. But, and I'm just going to put together our 2-second sales pitch here, Brad. If you go get it from you can get the wall anchor on Amazon, but if you get it from our website, Bob and Brad, you'll actually get 4 of them instead of 3.
Right.
We throw an extra one in.
4 anchors gives you more options.
Nice, gives you more options. All right, Brad, you have another study to talk about.
The next study we're going to talk about is, you know, can you do aerobic exercise, and is aerobic exercise beneficial or more beneficial than non-aerobic? So there was a study by the American College of Rheumatology. They took 120 people. 50% of them, they put in an aerobic exercise, 50% non-aerobic.
Would you define aerobic as you're getting the heart rate up?
Right.
I mean, basically,
right. You're getting the heart rate up, you know, to above 50% of max, which means you can still talk. You should be able to communicate with someone without having to catch your breath, but at the same time,
you're working a bit.
Right. Yeah. Exactly. You may, you know, break a sweat, that type of thing. So, and the results were clear. They said it was a distinct. A distinction. Can I say that? Distinction.
Can you give examples what the aerobic would be?
What they did, like water aerobics.
They did water aerobics. Okay.
Yep. Typically, you know, less weight bearing on the joints, but you can do any activity that your body tolerates that you like to do to get the heart rate up to that 50%.
So biking would be a good one for that,
right?
If you're biking hard enough.
Right. Yeah. Exactly. A stationary bike would be probably good for a lot of people.
Yeah, it's more consistent that way. Otherwise, you're going up hills and down hills.
Exactly. But they showed the aerobic capacity. They tested that. That naturally got better. It's not surprising. Again, they did the same test, gait speed, the 50-foot walk test. Their gait quality and speed went up.
Their walking quality improved.
So their walking improved, which that's pretty important in
it is,
daily
especially
life.
when we got arthritis in your hips and knees and maybe ankles.
And they also did a scan or a test for their depression and anxiety, and that both improved.
And I think you find that pretty universal, is that whenever you exercise, those types of things improve.
Right.
I mean,
it's nothing new or surprising.
Right.
So the big thing is, you know, people that have arthritis, you have this pain, particularly a lot of people in the morning when you get out of bed. You got to try and work through that. It can be extremely painful with people with rheumatoid.
But that's a good point, though, Brad. Why is it hurting in the morning? Because you've been still all night long. The joints have not been moving all night long. So as the day goes on, if you find out that things feel a little bit better, then that's showing you right there that movement is good for that joint.
Right.
So
we've got, you know, it just kind of...
We're giving you some options here.
Exactly. Go ahead. Continue to watch our videos. We have a lot of options on low intensity exercise. Go to the fitness gym. A good option, Bob. Now, this is only for certain people, But if you can go to a personal trainer, you have to pay for them, unfortunately, but they will really
they can customize a program for you. So that
and actually physical therapists are even better. Yeah,
that's right. We know. Well, now you're gonna get upset to all the trainers.
I know. I don't want to
we
get
got the yoga people mad. Now it's gonna be the trainers too. Good. Thanks for watching. Good.
Good luck.
Good luck. Thanks for watching.